Hello, and welcome to a successful transition from monogamy to open. We're going to talk more today about continue on with our series of talking about the three types of erection problems and how to know the differences and who to see. And today we're going to finish up with talking about the psychological issues, which are also referred to as performance anxiety. Now, the psychological and performance anxiety issues can often be challenging because this is oftentimes where a lot of men are much more comfortable dealing with the medical side and going to a medical doctor rather than seeking help from a therapist, and especially a sex therapist. So this can be oftentimes more challenging because then it feeds into people's fears and egos, and when that gets involved, it makes it often much more challenging. Now, some of the symptoms you're going to see with performance anxiety versus the physiological or the hormonal problems are that, first of all, you usually still have good morning erections, and you still have good erections with masturbation. The problems start more when you have partnered sex. And whether it's in your primary relationship or especially when you get into open relationships, you start to have new partners, there can be a lot of internal fear and insecurity that start seeping in. And your mind is very powerful, and your mind can absolutely overrun your body's mechanisms and stop you from having erections if you get too much in your head, which is usually the problem. Because then what happens once, then that fear and that anxiety takes over, that insecurity starts seeping in, and you keep worrying about it happening again. Well, guess what? That just makes it happen again. And now you've had two experiences where you're having trouble getting erections, and the fear grows and the anxiety grows, and it just continues to snowball from there. Oftentimes, hormone levels are fine when you're dealing with psychological problems. The physiological problems are fine. You don't necessarily have any of that going on. And so then your typical erection drugs like Viagra and Cialis really don't work very well when you're having psychological problems, because your brain will override whatever drugs you're putting in to try to get more blood flow. Your brain's going to say, nah, I don't care what you're doing. We're shutting this down. So good, having that ability to really get a hold of the psychological issue is really very important. And so what I tell people is that if it really strictly is a psychological or a performance issue problem, the best person you need to go to is a certified sex therapist, not your general therapist. Your general therapist is really not trained for this kind of thing, because you're going to need to do a lot of talk therapy, the cognitive behavioral therapy. You've got to get into the head. You've got to get that anxiety reduction. You've got to figure out what are the life and relationship issues that are going on, because often it is more than just calming whatever's going on in a man's head. If there's other relationship issues going on that are not being resolved, they're not being dealt with, you can give him all the relaxation techniques, the cognitive behavioral therapy, and I often even do clinical hypnosis with people, which can work very well. The problem is if you send them back home and those relationship issues are not being addressed, are not being fixed, the problem is going to continue, because that's got to be addressed as well, because you're not addressing the whole problem if you don't address that. It's not as simple as just sending him off by himself and say, oh, go fix you. No, if there's a relationship problem, both people need to be involved, or more people need to be involved, depending how big the relationship is. Because if the partner doesn't understand that this is not within their control, it's not about whether they think they're attractive enough or have gained weight or whatever their belief system is that is causing them to get upset every time their partner isn't able to get an erection, well, no matter how good of work you do, that's just going to continue. And the unique aspects that we see about it with open relationships is that oftentimes when people transitioned from a monogamous relationship to some version of open, well, they've been with this one partner for 5, 10, 15, 20 years. You're used to that rhythm. You're used to feeling that level of comfort and vulnerability with that one person. And now you have these other people, and it's natural that you want to impress them and you want to do well, and you want them to think that you're a good lover. And that feeds a lot of pressure on the person. They often go into those situations not just going into it as comfortably, but there's all this pressure to perform and to be a stud, and you're comparing yourself to the other men around, especially in like a swinging lifestyle situation. It's an enormous amount of pressure. Plus, particularly like in swinging situations, if you're in a party or a club and there's other people around you having sex, that's not the way you're used to having sex. You're used to it just being the two of you, either in your bedroom or in the bathroom or wherever, alone. And you don't have other people next to you having sex, making noise, providing all this other stimulation. You've got the visual stimulation, the auditory stimulation. It's so much and that's even if you're just one-on-one. And if you're in a group situation where now there's multiple people in the bed, there's other people touching you while you're touching someone, and it can be very overwhelming for a lot of men. And so it's no wonder that a lot of men lose erections in those situations, which then affects their confidence later on. And it can be a problem because then they think, well, I've got to do all these extra things. I've got to take Cialis and Viagra. And that's a dangerous combination. Like I don't care if you're in your 30s or 40s and you're in generally good health, that is not a good thing to be doing. Because now you're training your body that it needs all of these chemicals in order to get that blood flow. You're training your mind from your fear that you need all of these to keep going and to be able to perform. And now you're setting yourself up really to fail. And that's how sometimes people get these combinations, because you can have a combination of physiological problems where you might need a little help from the things like Cialis or Viagra. You might have some hormonal problems where some extra testosterone supplementation could be helpful, but then you also add in the psychological problems. And so then it gets very complex on who to see first, how to treat this, from what direction. And it really may take a multitude of practitioners to really help you get this figured out. So what I usually recommend in that situation is start on the low end. If you normally have morning erections, you normally have good erections, but they maybe are not as firm as they used to be, you might really just be dealing with some venal leakage where the veins are leaking due to age. And then a cock ring can be quite helpful in that kind of situation. Start with that and see how that works. If that's not enough, then maybe you go to your general practitioner and you get, make sure that your arteries are not blocked. If there's medication issues such as cholesterol or high blood pressure medications, maybe you need to have them changed to something that's less likely to cause erection problems. And then if there's still problems, if you're finding you have low desire, you're tired, you're more depressed, you don't have as much energy, you're not sleeping well, in addition to erection issues, okay, then you need to see the urologist to talk about hormones. And if still in certain situations you're having difficulty with erections after all of this, and you're feeling that fear of what if I don't get an erection again? Oh, and you're going to know that. I mean, you're going to know that feeling of anxiety of feeling like, oh, I've got to hurry up. I've got to make sure it happens. That's more of a sign of a psychological issue. Now you need to come see somebody like me. And particularly depending on where you live, where I live in the Denver metro area, there are a lot of certified sex therapists. There are a lot of very good ones. We're very fortunate here. In other parts of the country, unless you're in a larger metropolitan area, you may not have as many options, and that can be much more challenging. But that's when you really need somebody who has that specialized training in sex therapy to help you with the psychological issues and the performance anxiety. So that's all for this series. I hope this has been helpful for you. If you have questions, always feel free to private message me. If you haven't already joined the private Facebook group, A Successful Transition from Monogamy to Open, please do. Like, we have some great conversations going there. It's a great place to learn from other people, other people's experiences, and we'd love to have you join us. Thanks so much, and I will see you next week. Bye.